Well, hello everyone. This is Dr. Mike, your physical therapist. Hey, today we've got a special guest from Vascular and Vein Health. We'll be back in a few seconds, okay? Well, hello everyone. We are back. We are here. We are here at Hab Thompson Farm, and we got a special guest for today. We got Dr. Michael, and then of course Ryan. They're from Vascular Institute here in Jackson. They just recently opened up their facility, and it's amazing. And then I just would like to ask them who they are, what do they do. So I'm going to back up myself a little bit. And again, if you're watching live, comment live. Watching on the replay, comment replay. So we're just kind of tight right here. We're all tall here, right? So minimum of 6 foot, right? That's right. So let me move back a little bit. So Dr. Michael,
Hi there, I'm Michael Corey. I'm a vascular surgeon as part of a bigger group called the Vascular and Vein Institute of the South. We have 14 different office locations across the Mid-South. And I'm here with one of my coworkers, Ryan Deedy, who's our Director of Marketing.
Howdy, howdy.
And we were just excited to announce that we opened up a location here in Jackson, Tennessee, and we just started seeing patients here today.
Wow, amazing. Well, before we keep on asking Dr. Michael here, Ryan, tell us what you are and then what do you do with the Vascular Institute and where are you from, man?
Yeah, so originally from New York, but
what are you doing here, man?
Yeah, no, I moved years ago in 2005. I did public and media relations for the Grizzlies. That's what brought me to the South. Did that for a few years.
Maybe we can get some extra season tickets.
Yeah.
But then pivoted into actually outpatient vascular specifically, and been doing that for 18 plus years now in terms of I'm the director of marketing, which is great because I've got 5 amazing surgeons and several nurse practitioners and a whole team of great people that I get to work with, and super excited. We've always wanted to have a Jackson presence, and it's really neat to see that come to fruition today. So,
well, it's funny that you mentioned that, working with physicians and nurse practitioner. The beauty of what we're doing in healthcare is we're actually changing people's lives. At the same time, we're making money. What kind of business can you be where you get to touch people, change people's lives, extend their life as a vascular surgeon, and still make a little bit of money out of it? So let's go back to the main guy, Dr. Michael here. Dr. Mike, where are you originally from?
Originally from southeastern Massachusetts. I grew up in a town called
What's up with all this Yankees?
From the north as well, and kind of a southern transplant. I did my surgery residency at Vanderbilt in Nashville, and then I went back to Boston to do fellowship in vascular and endovascular surgery at Massachusetts General Hospital. Wow. Then I was in private practice outside of Atlanta, Georgia for almost 10 years, and I'm fortunate to have joined this private practice group, here based out of Germantown, Tennessee, but we have several locations, across the Mid-South. So.
Wow. Well, tell me about how. First, of course, you're a physician, right? You went to med school, and then you're a specialist. How does one decide and become to be a vascular surgeon?
It's a good question. Vascular surgery, is essentially the field of blood vessels, treating blood vessel problems mainly outside the heart. So we deal with blockages in blood vessels. We deal with aneurysms, which are ballooning or weak spots in blood vessels.
What are you looking at me, sir, when you say weakening of the blood vessels?
No. We treat a wide variety of different disease processes, and we have multiple different ways to treat it, most of the time with minimally invasive methods. And so that field of surgery was very attractive to me for those reasons. Basically, there's more than one way to fix a problem. We get to individualize and tailor the care to each individual patient. So, we definitely treat an older population, and as the population gets older and older, and people are living longer, there's going to be even more of a need for vascular surgery.
That's true.
And so we are very, very prominent in the community right now, and we look to expand our business to Jackson.
There you go. Now, we need that. We need that more. The business of healthcare. When I say business of healthcare, the people are getting older. You know, a lot of people will say, "Oh, there's another competition here." Just like in physical therapy, they'll say, "Why is there like a physical therapy in this corner?" No, think about the abundance mindset. I'm not saying people will get sick, but think about the abundance mindset. And you think if more people that you serve, the more people that you help, and the more people that you can change people's life and extend their life, and they can't serve them all. That's why there is specialization like this. Doc, you mentioned about vascular.
Mm-hmm.
What does the vascular surgery entail? Do you work on the veins? Do you work on the actual artery,
Mm-hmm.
or both? Or you said outside of the heart, right?
Mm-hmm.
How does that work, sir?
Right. So we work on both arteries and veins.
Mhm.
So arteries are the tubes that carry the blood away from the heart, and
Mhm.
veins are important to bring the blood back to the heart. And we work on pathology for both systems. With arteries, like I mentioned, blockages or aneurysms. With veins, we're mainly dealing with varicose veins and vein disease, leg swelling, things like that. That could really improve, patients' quality of life. So, essentially, we're plumbers for blood.
There you go.
That's what it
there
is.
you go.
Yeah.
I love that.
Mhm.
I love what you said about the arteries that supplies the muscles.
Mhm.
Okay, so there are different flows. If you're watching live, comment live, watching on the replay, comment replay. I'll go to you someday.
No,
Right. So there are different flows in your body. Okay, so let's talk about the actual heart itself. Okay, the first one, the heart pumps. All right, the heart pumps and it goes out to the whole body. And that arteries the arteries that carries the blood supplies the muscle. Once the muscle has used up that blood, the nutrients and oxygen and everything, it goes back up to the heart, to the lungs, and to the heart. And that is your veins, ladies and gentlemen. And if imagine like what he said, the like a plumber, the hose, the pipes. If those pipes are blocked, even though you have good heart pumping, it's going to block and it's not going to flow. If that blockage there gets dislodged, what do you call that? We call it a blood clot or DVT, right? And you don't want those blood clots to travel and go to your lungs. You get pulmonary embolisms, right? So it's very important that you go consult a vascular surgeon, an expert like Dr. Michael, to make sure that is that specific artery or vein is open enough to have that blood flow going. Now it's different too. You know, you talk about the pipe, you also got to talk about the actual quality of the blood. Is that correct, Doctor?
That's right. Yeah.
So the quality of the blood is also very important. If you are diabetic, right? They see a lot of that. If you are diabetic, guess what? If you have a water and you put more sugar in that water, what happens to the water? It becomes thick. The same thing with the blood. If your blood is thick, it's not going to flow, and there will be sugars there. There's fat there. It's not going to flow. That's where they come in. So let's talk about the procedure, Dr. Mike. So what is that specific procedure for if you're talking about arteries? Is there a specific name for that? Or how would they know if it's the arteries or the veins that goes back? Would you determine that?
Well, one of the most common disease processes that we deal with is called peripheral artery disease, which is hardening of the arteries in the legs. And so patients will often present to us complaining of pain while they walk. And that happens because if there are leg blockages or artery blockages in the legs, that patients are not getting enough oxygen down to their muscles when they're trying to walk. And so what we do a lot of times are minimally invasive procedures to help open up those blockages in the legs. Mainly that's called an angiogram or a procedure where we put a catheter in the arteries and inject with dye. And if we see some blockages, we can usually fix that with balloons and stents and things like that to make people feel better. When peripheral arterial disease gets really bad, patients sometimes will get wounds on their feet that won't heal, or they'll get pain at rest. A lot of times that's very common in diabetic patients or patients with kidney disease. And then it's our job to make the blood flow as best that we can make it down to the feet in order to heal those wounds and save those legs. So peripheral arterial disease is one of the most common disease processes that we deal with, and that happens especially in older people.
So I like what he said about peripheral arterial disease. You'll see that in your chart, in your patient's chart, or in your chart, you'll see PAD. What is that? Is there a pad here? No, we're not padding it. No, it's called peripheral arterial disease. If you break it down, like what he said, peripheral, what does peripheral means? It's from the outside, right? The periphery, just like peripheral vision, the outside there, the arteries that goes out. And he said the hardening of the arteries, if it's hard, like a water pipe or a water hose, it's going to be hard to expand, dilate and constrict, right? The hole is getting hard. And the more harder it is, the more difficult the blood will flow. And that's what he's doing. He said about the
Angioplasty.
angioplasty.
Mhm.
They put a dye, and then
Yeah.
they look at how if it's flowing well, right?
Mhm.
And they look at the what's that uh, machine that you use?
X-ray machine for
X-ray.
endoscopy.
Yeah.
Mhm.
And then they look at it if
Mhm.
it's flowing well, and if they see it's blocked there, that's where they do the angioplasty.
Right.
All right. Let's talk about the veins, sir. I mean, how about you mentioned about the varicose veins?
Right. So on the flip side of things, in the legs, when the blood is not returning back to the heart as well as it should be, the blood will sometimes pool within the lower legs, and that causes unsightly veins, varicose veins, or bulging veins. It causes symptoms of leg fatigue, leg swelling, especially at the end of the day. And veins are different than arteries in that they don't have pulses. They have valves that have to squeeze the blood back to the heart like a tightrope. And when those valves start to break down as we get older, the blood kind of goes back and forth on its way up to the heart. And that causes the blood to pool. And so our job is to sort of reroute the circulation or eliminate flow through the veins that aren't doing such a good job. And we often have minimally invasive procedures for that as well. One most common one that we do is called radiofrequency ablation, which is where we put a catheter in a vein that's not doing a good job, and we heat that vein up and close it off. And so it can help. Patients usually feel a lot better after that procedure. Their legs feel better. They feel less tired. They're less swollen. It helps prevent new varicose veins from coming. And so that field is really taken off within our specialty as well.
Very good. That's good. That's good. So what Dr. Michael is talking about is that, let's just say this is two veins, okay? The two veins, one here and the one here. It's not this big, right? So if one vein, the valves, okay, it's not pushing back, they kind of RFA it, radio frequency ablation. They stop and block here. In that way, there will be more flow here. And then if there's more flow here, it will go back to your lungs and to your heart. Then you get more circulation. Because if not, just like a water hose again, if this one here, you decrease the pressure. But if you close one side and then this one goes better flow. All right, Doc. So you call it RFA. And then let's go back to the symptoms of PAD and then the venous issue. When it's PAD or arterial issue, they have pain, right?
They usually have pain in their calves when they walk. And so when they're trying to exert themselves or walk a certain distance, the muscles don't get as much oxygen as they need. And that's due to the arteries being blocked. And that's when usually it causes what we call claudication or pain in the legs when you walk.
Intermittent claudication, right? How about if it's veins, sir? What kind of symptoms? The varicose?
That's usually varicose veins, leg swelling, itchiness, fatigue, things like that. Kind of a different, whole different set of symptoms. And it's usually more at the end of the day when you've been working on your feet for long periods of time, standing on your feet. The blood pooling will get worse by the end of the day, and that's when we're starting to feel those symptoms more.
Let me just remove this thing here. Is there any difference between the difference if it's the front that hurts or the back?
Not necessarily. No.
Okay. All right. Well, so that we talked about the symptoms. We got to talk about the actual diagnosis, the symptoms, and the treatment. Now the next question will be, how can they find you, sir? I know you've been all over. You're all over here. You got Germantown, Memphis, Millington, now here in Jackson. If you're in Jackson, I'm going to go to this guy here, Ryan.
Sure.
Ryan, what locations can they go to specifically here in Jackson?
So Jackson, we proud to say we just opened up and saw first patients today.
Woo!
Yeah, big deal. We're over at 15 Old Humboldt Road here in Jackson.
You look at me when you say old.
Oh, yeah. But I do want to touch on one thing because I think it's really important. It's something because we do a lot of community education too, which I'm sure we'll be doing here as well. It's a big part of what we do is work with the community at that level, both patients, providers, families. One thing that we see with PAD is unfortunately, 50% of those people are going to be asymptomatic.
Mm.
So a really big thing that we push is that we really want people to pay attention to those risk factors first, because oftentimes they're not going to exhibit any signs or symptoms till they're a little bit further down the road. Obviously, if we could be proactive and kind of beat these things to the punch, it's a good idea. So diabetes, number one, far and away and above, the largest risk factor for PAD, smoking, obesity, hypertension, hyperlipidemia, all those things. We really try and encourage folks to, if you're checking a lot of those boxes, make sure you get a good baseline check on yourself, because it will get worse. It is a progressive disease. It's not going to get better on its own. And yes, procedures are amazing. But if we can slow the progression on the front end, that's a good thing too. So I just wanted to put that in there. If you have any of those risk factors, we want to kind of look at that along with then if there's signs and symptoms, because a lot of people, there's just nothing telling them yet or showing them yet that they have PAD, in terms of they might not have any pain just yet, or sometimes, and Dr. Corey can speak to this better, they write things off, right? So if they have leg pain, they're going to write it off as everything from gout to arthritis. They swear they have, arthritis, restless leg, all these things. That could all be going on, but they could have an arterial component that's there as well. Or sometimes things can mask different things. Neuropathy is another big one. That they could be all those things, and vascular. So we work really hard to identify the risk factors, the signs and symptoms, the imaging, which is great, to really put the whole puzzle together.
That's good. Well, thank you for pointing it out, Ryan, because prevention is the key. You don't want to wait until you have a stroke, right? You want to prevent it from getting it worse. So I like what you said now, patient education. And then like what he said, the being asymptomatic. What does asymptomatic means? A means absence. Symptoms mean symptoms. You might have not symptoms right now, but it's happening already behind the scene. Just like a stroke, you don't know if you're getting a stroke. It just happens when it's already worse, like a heart attack. And then I want to point that here too, about other masking symptoms. I always want to go back to the flow, to the blood flow. Everything starts from the flow. Your pain on your knee or on your leg, most of them are actually blood flow issues because there's not blood flowing it. Remember, I don't know if you guys are Christians, but there's power in the blood of the flow. If the blood carries oxygen, that carries nutrients, if there is not blood circulating and flowing to that specific muscle, guess what? It's going to die, right? It's going to hurt. And same thing if it's not going to come back, it's pulling down there, you get some swelling. So it all boils down to the flow of the blood. So we're talking about the heart, we're talking about the arteries, we're talking about the veins. Let's talk about where you guys can find these two amazing guys here. So they're found at 15 Humboldt Road, here in
Humboldt Road.
Old Humboldt Road. You gotta remember that, right?
Yeah.
So here in Jackson, Tennessee, they're pretty close to our other location in Highland. So it's like right there in the corner if you are going to our Highland location. So again, where can they find you, Ryan? The telephone number and address and website.
Yeah, so you can go to vvisouth.com. Everything's on there, all our locations, including the Jackson location. You can actually book an appointment online.
Oh, amazing.
Or you can call our main number, the 901-390-2930. Is another great way to get in touch with us. We quite often get asked, like, don't I have to have a referral to come see you? You do not. We have plenty of patients that, whether through word of mouth or come into community events or whatever the case may be, proactively pick up the phone and want to give us a call, which is great. And that's the whole reason. Honestly, the one of the key kind of buzz terms used to be limb salvage, right? And that kind of insinuates let's wait till it's bad and then come in and save the day. We're different. We have what we call our limb preservation program. We want to be more proactive and like I said, kind of beat it to the punch, because unfortunately, I think the statistics like 180,000 amputations annually due to vascular disease, and
And they
about
could we
half
could
of
have
those.
saved that.
Yeah, and what's crazy and what's really hard for folks like Dr. Corey and I is that half of those amputations happen without somebody going, whoa, whoa, time out. Let's screen this to see if we could save it with minimally invasive techniques and or surgical techniques. Half the time that doesn't happen. So 50% of the time, nobody says time out before we cut this limb off. Let's see if we can save it. And I mean, it's 2026. Right? What are we doing?
I was going to say that too.
It's wild, but yeah, that's the reason we have such an open door policy for patients to, yes, they can be referred by any of their care team, but certainly if they feel like a family member needs to come see us, they can contact us directly and or get online and make an appointment. And that's why I say we encourage people to be proactive with this stuff.
Well, it's funny you mentioned that, same thing in therapy, physical therapy. How many times we've seen they got knee replacement, hip replacement, even back surgery, that actual physical therapy, stretching and moving and strengthening, because you can have all the surgery in the world. I mean, I'm going to preach on therapy itself. You can replace all your joints in your body, but if you don't move it and then actually fire those muscle fibers, it's not going to do you good, because it's just going to contract again and it's just going to make it worse. And same thing with this. You can have your limbs cut. I'm sorry, right? You can have amputation, all right? But if you don't improve that circulation, you're going to have another limb, another issue again for amputation. So you got to make sure that the flow is working, the right blood flow, the venous flow, the arterial flow. In that way, everything is properly flowing back and forth, right? Let's go back to you, Dr. I call him Dr. Michael Corey. But again, any last parting wisdom for those people who have pain, who have anything that they're having right now on their legs? Any last parting wisdom for them?
We're open for business, and we welcome anyone that wants to come and visit with us and talk more about what's going on with them. A hardening of the arteries in the legs is certainly one of the most important things that we help patients with, but we treat the whole patient. There's lots of different blood vessel pathology that we treat, and we'd be happy to help or offer another opinion. And then anything you need from a vascular standpoint, we are here for you.
Very good. Thank you, sir. And last but not least, before I go, a lot of people will ask this probably, what insurances do you accept?
We take pretty much everything.
Medicare,
all of it. Yeah, we want to be a place where everybody can come and be seen, and then even for our referring providers. But not only at our outpatient locations and procedural centers, and we probably opened up our first ambulatory surgery center end of last year. That's in East Memphis. So we're really excited about that, along with our outpatient procedural centers, our clinics, but they also do some work at the hospitals as well. So with them doing those things, we kind of have to be on board with everything. But to us, that's a big advantage for the patient, because we can literally see just about everybody.
There you go. There you go. Gentlemen, thank you very much. Before I let you go, for those people who are watching live, comment live, watching on a replay, comment replay. Before I let you go, always remember the word FAST, F-A-S-T, letter F. Find people that will bring out the best in you, because you are the average of the 5 people you hang out with. So today I hang out with amazing Dr. Corey and Ryan here. I feel like I want to check out my vascular health, right? The next letter is letter A, take action. All this stuff that we're doing is not going to do me good. It's not even going to do them good if you don't take action. Take action, grab that phone, call. Hey, do you accept my insurance? Hey, what are the symptoms? Do you have an educational material that I can use? Call them 901-390-2930. Check them out. Take action. Okay. Next letter is letter S. Share and subscribe. The more shares, the better. You have a Facebook page or Instagram?
Sure do. We got all the things.
Okay. Share their website. Share. They have educational materials in their Facebook. If you're watching in Facebook, why it may not be applicable to you, but it could be applicable to someone else, to your mom, to your sister, to your brother, or to your uncle who needs some vascular checkup. And last but not least is letter T, is teach it. Why? Because when you hear it, you forget. When you see it, you remember. But when you're actually teaching it, that's what they're doing here. They're teaching us, right? You actually understand it more. Again, thank you very much. Be awesome, be great, be excellent. And we'll see the next episode of our Jerry Hab show. And then hopefully Vascular and Vein Health Live. All right. I'll see you around. Thank you, ladies and gentlemen.
HelloNote is a truly therapist-friendly practice management solution with integrated EMR that will enhance workflow,